Introducing the HeartSine 350p defibrillator from First Aid Accident and Emergency, an innovative device that provides CPR coaching visually and verbally. Let's show you how to use it. Always check for danger first, and then try and gain a response from your patient. To gain a response, squeeze the shoulders of your patient and ask them to talk. If the patient is unresponsive and not breathing, call 000 and start CPR. Then get someone to get the defibrillator.
Press the green on-off button to turn on the Samaritan PAD. Depending on the pad pack currently installed, you will hear either an adult patient or a child patient prompt. If the patient is a child between 1 and 8 years of age, you should ensure a pink pediatric pack is installed. If a pink pediatric pack is not available, you may use the grey adult pad pack instead.
Adult patient. Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin.
The Samaritan PAD automatically assesses the patient's heart rhythm.
Assessing heart rhythm. Do not touch the patient.
And recommends whether or not a shock should be delivered.
Shock advised. Stand clear of patient. Press the orange shock button now. Shock delivered.
When performing CPR, it's important to apply effective chest compressions for each 2-minute cycle as directed. The SAM 350p will prompt you to begin CPR.
Begin CPR. It is safe to touch the patient.
The SAM 350p will tell you how and where to place your hands and instruct you to keep in time with the metronome.
Place overlapping hands in middle of chest. Press directly down on the chest in time with metronome. Remain calm.
In addition to staying in time with the metronome, your chest compressions should have a depth of at least 5 centimetres or 2 inches, and not greater than 6 centimetres or 2.4 inches for adults and children greater than 8 years in age. The combination of chest compressions and defibrillation is the best treatment you can provide until medical professionals arrive on the scene. Once you have completed 2 minutes of chest compressions, the SAM 350p will prompt you to stop chest compressions.
Stop CPR.
And again assess the patient's heart rhythm.
Assessing heart rhythm. Do not touch the patient.
Sometimes, no shock is needed in a life-saving situation.
No shock advised.
And the Samaritan PAD will tell you in that instance, or advise you to continue to perform CPR. After using the Samaritan PAD, slide a new pad pack into the unit and store it as usual. Remember to follow your local battery disposal guidelines. Once a week, check that the green light is flashing so that you know the unit is ready in case of an emergency.
We also recommend checking your defibrillator monthly as per the monthly defibrillator checklist.
With a unit nearby, you are always prepared to respond in the event of someone going into sudden cardiac arrest.
HeartSine Defibrillators, brought to you by First Aid Accident and Emergency, a 100% Australian-owned defibrillator specialist.